Hey everyone, welcome back. Healthcare, it's a topic that's always in the news. And it's probably something you think about too, right?
Hmm.
Especially with the rising costs these days. It feels like you can't escape it.
It's a big one, for sure.
And it can feel overwhelming to even try to understand it all.
Yeah.
But that's what we're here for. Today we're taking a deep dive into the heart of the healthcare debate in the U.S. We're going to try to break it down and make it make sense.
Sounds good.
Our guide for this deep dive, this really interesting article called Health Insurance, a fundamental right or an economic burden.
Catchy, right.
It gets right to the point.
It does, and that is the question, isn't it?
It is.
Is healthcare a right that we all deserve, or is it something that each person is responsible for figuring out on their own?
Well, and to add another layer of complexity to it, right, the U.S. is kind of unique in how we handle health insurance compared to other developed countries.
Exactly. So let's talk about that. I think a good place to start is with the cost, right?
I mean, I don't know about you, but every time I see a headline about rising health insurance premiums or the cost of prescription drugs, it
Mm-hmm.
just makes me cringe a little.
Yeah, I feel it.
So what's the deal here?
Well, the U.S. spends a lot more per person on healthcare than other developed nations, but we don't necessarily have better outcomes to show for it.
Yeah, how does that even work?
It's a complex system, right? But one thing this article highlights is the huge burden of individual costs.
Makes sense.
Like, for instance, the average cost of health insurance, for individuals and families in the US, it can be thousands of dollars every year. It's one of the highest rates globally, actually.
And I feel like that really hits home for a lot of people. I mean, those high premiums, out-of-pocket costs, it all adds up.
Definitely.
And for some people, it could even mean delaying or skipping necessary care because they just can't afford it.
Yeah, absolutely.
So it's not just about having insurance. It's about being able to actually use it when you need to.
Yeah.
Right?
Exactly. And that brings us to another key point. Even if you can afford insurance, access to quality care isn't a guarantee in the U.S. system.
Wait, really? So you're saying even if you're paying for insurance, you might not get the best care?
Well, think about it this way. The type of insurance you have can drastically impact the care you receive. Someone with a basic plan might struggle to find specialists or face those long wait times,
Oh, okay.
while someone with a more expensive plan might have a lot more options and flexibility.
So are you telling me that if you break a leg, your access to the best care could depend on your insurance plan? That doesn't seem right.
It's a valid concern for sure.
So, okay, here's the core of the debate, right?
Okay, yeah.
The article lays out two sides. One, healthcare is a right, just like in lots of other developed countries. Everyone deserves access, no matter how much money they make.
Yeah.
And the other side says, nope, it's an individual responsibility. It's up to each person to figure out their own health insurance and care. And that our current system, with all its competition between insurers,
Yeah.
that's supposed to drive down costs and give people more choices, supposedly.
Right, theoretically.
But does it actually work like that?
Well, that's the million-dollar question, isn't it? Does all this competition really lead to better affordability and access for everyone? Or does it end up creating those inequalities, the ones we were talking about earlier?
Right. It's a tough one.
It is, but luckily, this article doesn't just leave us hanging with these questions. It actually offers some potential solutions.
Oh, okay, so there's hope.
Maybe.
Maybe.
Let's hear it.
Well, first up, you've got universal health care.
Okay, yeah.
And of course, we can't talk about that without mentioning Medicare for all.
Right. It's been in the news a lot lately.
Exactly.
Yeah.
Then there's the idea of improving the laws we already have, focus on lowering costs and really upping the quality of care. And then there's price transparency.
Transparency.
Yeah, so consumers can actually see what things cost and make informed choices about their health care. Oh, interesting. So these solutions, are they realistic? I mean, do you think any of them could actually happen?
Well, it's hard to say for sure, you know, but the fact that they're even being discussed shows that there's recognition, even within the US, that the system needs some work.
Yeah, that's true.
Right. It's a start at least.
Okay, so after this deep dive, what are your thoughts? Where do you stand on this whole healthcare debate? Is it a right or is it a responsibility?
It's complex. There's no easy answer. You really have to consider all sides of the issue.
You're right. You're right.
Yeah.
It definitely gives you a lot to think about. You know what? I'm going to leave you with one last thought to ponder. If you were designing a healthcare system from scratch, what would be the most important thing to you?
Oh, wow.
Access for everyone, keeping costs down, making sure people have choices. or something else entirely? That's something to really chew on, isn't it?
It is.
Well, on that note, that's it for this deep dive.
Yeah.
Thanks for joining us, and we'll see you next time.
See you next time.